physician's perspective, I know everybody probably has their own idea about what's good and what's bad about all the discussion that's been going on for the last year or so about health care. But I think when I watch C-SPAN or listen to the people talk about health care, they always talk about the health care crisis. And does anybody here think we have a health care crisis? Good. Well, I think you're right. We have a health bill crisis. I think the way I would describe it is we have a crisis of government involvement in health care. That's the crisis. I think if you listen to all the 10,000, I don't know how many thousand pages now, the more they write and the more they add on, it becomes more and more confusing. If you try to understand it all, it's virtually impossible. I think the bill was designed to fail from the beginning. And what that'll do is create another government-created crisis, and then who knows where we'll go from there. So I think everybody agrees that the bill is too massive, it's too costly, it creates a huge new bureaucracy. We have how y'all like to pay the salaries of 17,000 new IRS agents and their pension funds and all their benefits. That doesn't sound American to me. You got the answer. I think when you talk about taxing people and then giving them the money back in the form of health care benefits, all that's going to do is result in people having decreased access to care, and of course eventually the government's going to ration care. And care is going to have to be rationed if we're going to have high quality care, but if it's going to be rationed, it needs to be done by local people, not by people in Washington, D.C. Those decisions you make every day, whether you decide to go to the doctor or take your mom or dad in or keep them home and say, well, it may be a good idea to go to the doctor, maybe we shouldn't go today. Those are the kind of decisions you need to be able to make. There is a discussion now, apparently it's buzzing around the politicians and some of the people involved in health care legislation that's called a medical home model. And what it involves is instead of the government paying money to insurance companies or to hospitals to take care of people or doctors, you pay it to the doctor and then the doctor doles it out to whoever they deem it's appropriate. And they had this model back in the 1980s. It was called HMO, and it was the system was called capitation. And then that model, the HMO decides whether or not they're going to spend money on you or they're not going to. And the HMO makes more money if they spend less money on you. Well, now they're going to do that to doctors, and they're going to give the money to the doctors and say, well, you get a group of specialists and healthcare providers, nurses and physical therapists, and if you have a patient and you don't spend the money that we give you on them, then that money goes in your pocket. If you do, then it comes out of your pocket. So is that un-American or what? I mean, there's a lot of bad words for it, but I won't say any up here. Only the government can do that kind of math. I think what this involves is it's putting a scarcity mentality into the healthcare system in a country that's basically created abundance for the whole world. So why should we sign on to something like that? I think there's a doctor, a Cuban-born neurosurgeon by the name of Miguel Faria. He's currently practicing in the United States. But he puts all this government medicine in perspective from a doctor's standpoint, and he talks about the post-Hippocratic medical system, which is the way he describes where we're headed. We actually already are there. And you know, Hippocrates lived around 400 BC, and he was a Greek philosopher who basically was the first person to write down in words the special relationship that exists between doctors and patients. And he described that in detail, but it's now doctors, when you graduate from medical school, you take a Hippocratic oath. Nobody takes exactly the same thing, but it basically describes your sacred duty to take care of people and have them trust you so that you're doing the right thing for them. And this doctor described this post-Hippocratic medical system by this simple sentence. It says, the physician is required to act on behalf of the collective rather than on the of the individual patient. So that's where we're headed now. What that system I just described, you have to worry about the cost of the system and the government, how much money the government's spending rather than taking care of the patient. So they flip-flopped everything from the doctor-physician, the physician-patient relationship. You've probably heard a lot of people talk about that. But that's how this guy describes it, and I think he sums it up pretty good. This particular type of medicine has been endorsed by many people that we're aware of. One is Richard Nixon. Another was Edward Teddy Kennedy. A rather unpopular guy was Adolf Hitler. And the current president, Barack Obama. All of them have supported this type of medical system. So as far as from the doctor's standpoint, I think most of the people I know are against this. And I think we should write our congressman or run for Congress and tell them that we don't like what's going on and we want an American system of health care. The American system is what I call the abundance plan. And in this plan, we have more health care than we know what to do with, not so little that we have to start rationing it. And to do that, we need to have competition. We need to have competition in all the health insurance for doctors, for hospitals, all the services you get. Everything to do with health care there has to be competition, and the American people develop the products that they want and need. That's what made America great, not the government. The government just takes away from the people. The people are what made this country great. And if we're going to make the medical system great, it has to be the people that are going to do it. In this kind of system, I'm a cardiovascular surgeon, been that since 1984, and there's a type of hospital called specialty hospitals, and some of them are heart hospitals. There's some around here. I don't know if you've ever heard them. But they're being basically weaned down, and no more can be built, and the government's basically going to shut them down because they're afraid that they're taking money from the government that they shouldn't be taking. But in an abundance private capitalism, free market system, specialty hospitals would flourish because they would be in competition with other hospitals. The people would pay their insurance company to pay for expensive surgery that you had to have done, and say everything else you had to have done to you. You'd go to the doctor and pay them $20 or $30, just like they did before 1965 when everything was fine. There was not a crisis then. So that's one of the best things I think we could be doing as far as getting out of the government system. And there's many large corporations now, it's like Safeway. I don't know if you've heard of their system. They have a system where they self-insure. They have 200,000 employees, and they promote health within their business. So the people in the business get healthier. Their costs have gone down. They pay less money now for health care and health insurance. The whole thing has gotten, the business is making more money because the employees are healthy, and everybody's paying less money. That's the American system. More health for less money. And that's the way it works. They thought this up on their own, came up with it, and got it up and running, and it's highly successful. And he's been up to testify in front of Congress. Of course, they didn't listen to him, I don't think so. Well, I've got a rather unique idea as far as the government being basically the crisis, not the healthcare system. And what I would propose is that all the money now that's being funneled into Medicare be funneled directly back to the states. And if any money is going to be spent by the government in health care, it should be done by the states. That's the American way. I don't know if you've ever heard of it, but the Constitution. That's what the Constitution would recommend. And if we did that, that's the end of the health care crisis. I mean, the government won't be broke because they won't be having to do anything, the federal government. So that's something to think about, and I think it's a good answer to all these problems. And I just have to add at the end that